Hey everybody, welcome back. Listen, when it comes to feeling good, you have to put Windsong Radiology right at the top of the list. Now, sometimes when I'm here, we're talking about getting rid of your headaches. Well, today, we're going to talk about two more very, very effective things that they can treat. First things first, varicose vein treatment. And my guest, once again, is Dr. Dana Dunleavy, who is the Director of Interventional Radiology. Nice to have you here. And it's interesting because varicose veins, what's important to know here, is not just a cosmetic problem.
Absolutely. So we're basically trying to help people with symptoms of leg swelling, achiness, heaviness, and prevent long-term skin changes and ulcers.
And the treatments here are unbelievable because it's not your mom's surgery for getting rid of varicose veins anymore.
No, I mean, it's actually a great point that people are used to very traumatic, difficult to recover procedures, and this is a same day in and out of the office.
Wow. And I want to introduce to you a patient who had treatment here. This is Paul Cispaniak. And Paul, you had an injury to a varicose vein and then you sought treatment for it, but you had this vein a long time.
Yes, I did.
Yeah.
And it was very painful after I hit the vein.
Were you worried about coming in and getting it treated?
Not really.
Yeah.
I'm pretty good with that.
And in your case, it was much simpler than what you probably expected.
Exactly.
Yeah.
I went to work after the procedure was done that afternoon.
That's amazing.
Yes,
That's
it was.
amazing. Was there any anesthesia, anything like that?
Just a local.
Just a local.
Yeah.
Wow. Thank you, Paul. Doctor, there are many ways to treat varicose veins, but it's amazing that he had such a problem with the vein, and so many of them now can be done. It's really a minor procedure these days.
Absolutely, and we try to be very comprehensive about all the options in terms of heat-based or thermal-based treatments, as well as a new treatment, Venocil, that is a non-tumescent, non-sclerosant treatment, which doesn't require any sedation at all.
Are you folks the only ones doing this?
We've done a high number and quite a few in terms of this region as well as the country. And the wonderful thing about this is now in January it will be covered by Medicare and hopefully by all of the other carriers as well.
A lot of people will be going, finally, that's awesome. We talked about two treatments. The second one is for fibroid tumors, something I know a lot about because I had them myself when I was much younger. And the procedure to get rid of them was very, very complex and a very painful thing. These days, it's easy.
It's really great to have all of your options explained to you, and we try to work very closely with the gynecologist so that people know the options of hysterectomy, myomectomy, or uterine fibroid embolization, which is a non-surgical outpatient treatment, same day home.
That's amazing. Non-surgical, one-day treatment, and the patient is up and around. That is so different from the myomectomy experience or having to face a hysterectomy where you're not, obviously having children after that would be impossible.
Yeah, and the primary focus is uterine preservation. This is not a cancerous growth you're dealing with, but symptoms that you deal with, oftentimes very heavy menstrual bleeding as well as pain, achiness, urinary frequency. And so it's really the symptoms that we're trying to take care of.
All right, let's meet your other patient. We have Lorena. Lorena, you had fibroids and you had them removed.
Yes. I was in a lot of pain, and fortunately my gynecologist suggested Dr. Dunleavy, and it was the best thing I ever did.
Amazing how quickly it was able to be taken care of.
It was almost immediate. The difference I felt within a day or two, and I was back to work within a week, back to the gym.
Unbelievable.
Yes, it was great.
So that's wonderful. Congratulations.
Thank you.
You're
Thank
so
you.
welcome. Well, I'll tell you, these kinds of conditions can cause a lot of pain. So what we're urging you to do is to come on in and call, because you don't want to wait with something like varicose veins. You don't want to wait another month if you have fibroids. Come on in and see what your options are. I'm here at Windsong Radiology with Dr. Dunleavy. You can give them a call today at 929-9484 or visit windsongveincare.com.